An East Tennessee doctor says he's seen an unusual uptick in RSV this summer. This is something that we're dealing with at our house right now. The respiratory virus is typically seen in young children, even infants, as well as older adults. We're talking 65 and older.
If you missed Brittany the last couple of days, that's why. She's been taking care of her baby there. Dr. William Smith in Knoxville working on a trial vaccine for RSV. Erica Lunsford tells us how soon it could roll out.
RSV is a viral illness that we traditionally think of as small children and babies' illness, because that is where traditionally it's been diagnosed.
But Dr. William Smith says he's noticing it's a strange time in adults 60 and older.
There was an uptick earlier in the summer in RSV cases, which was sort of unusual in that usually we see an uptick in the fall.
Dr. Smith says when it comes to RSV, the hospitalization and death rate for adults 60 and over is similar to the flu. He's part of a trial working to find an RSV vaccine.
The biggest update I have is that enrollment is complete, which means that we now have the 20-some thousand people across the whole study that are necessary to provide data about the efficacy and the safety.
Dr. Smith hopes to know if the vaccine trial is effective by the first half of next year. If the vaccine works in adults, Dr. Smith says trials would begin for children.
Starting first with teenagers, subsequently with older children, and then with infants and very small children. Much like they did with the COVID vaccines.
While there's not a timeline for a possible vaccine, Dr. Smith says he's expecting to see a big uptick in RSV in the winter. In Knoxville, Erica Lunsford, WVLT News.
So what do you do? When it comes to safety precautions for RSV, Dr. Smith says people can do the same things they did for COVID. You need to wear your mask if you're concerned, socially distance, avoid being around other people when you're sick, wash your hands a lot.